they did research with mice. They implanted mice with breast tumors, and they stressed one group of mice, and the group that was stressed had a 30-fold increase in metastases. And when they
Wow.
gave the drug propranolol to block adrenaline, that prevented most of those metastases.
Mm,
So
that's
that's the
interesting.
single most important thing that we need to accomplish quickly with our new cancer patients. And of course, oftentimes when they go into the conventional medical system, see the oncologist, the fear of God is put into them immediately.
Yeah.
Those are not
Yeah.
generally spiritual, peaceful places, in one
No.
test into another test and so forth.
Right.
So hopefully those patients will come to me first so that I can um, get them spiritually in an understanding.
Welcome to the Functional Edge. I'm Dr. Julia Ward, and this is where science meets real world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. Okay, welcome to the Functional Edge podcast. I'm your host, Dr. Julia Ward, medical director and founder of Balanced Body Functional Medicine. Today, we're honored to welcome Dr. Jim Roach to our show. In this episode, Dr. Roach is going to be sharing his insights on uh, alternative cancer therapies and natural holistic health, and offering expert guidance to help you navigate your health journey with the latest advancements in functional medicine. So stay tuned for an engaging conversation that promises to empower and inspire your path to wellness. Welcome, Dr. Roach.
Thanks so much for inviting me to join your show.
Yeah. So, can you tell us a little bit about, I guess, maybe you can just describe your journey as a physician and, as one that integrates science, spirituality, and deep healing, and kind of what sparked your interest to look beyond conventional medicine?
Well, my life started out very conventionally. I went to Duke undergraduate, the University of Kentucky Medical School, and residency in Tallahassee, family medicine. And did 20 years of conventional family medicine. And then I was approaching 50 years of age and wanted to see how long and how well I could live. And decided, well, I'd passed my boards in 2000. My kids were out of the nest. So I decided to start reading every medical journal that I could and was attracted to Andrew Weil's nutrition and health conferences out in Arizona. And after a couple of years, he did a conference in New York City on botanicals. And at the time, New York City wasn't particularly attractive. And I said, why would I go there? I'll never use herbs in my practice. But my intuition said to go, and I listened to my intuition, and that's transformed my life. I ended up meeting Donnie Yance, and he's the top botanical medicine expert in the country. I've studied under him for the last 17, 18 years. He's had, and still is perhaps the best cancer healer in the country at this time. He knows more than most oncologists, for example, even with regards to chemotherapies that are considered. Uh, I've attended or hosted 60 national integrative health conferences not associated with drug companies, and you learn different information.
Yeah.
And so I've applied that. I put in 20,000 hours of study and research. So for about 2005 to 2020, I was glued in front of the computer reviewing research. Somewhat of a nerd. I've backed off a little bit on that, but that's transformed my life, and the outcomes that I've seen using these approaches have just totally blown me away. I didn't realize these outcomes were possible. Now, I also, a company there in Texas, SpectraCell Labs, I was
Mhm.
a part-time consultant for 10 years, so gained expertise in micronutrients as well. Uh, and then at a conference, this was also at Texas, the American Board of Integrative Holistic Medicine had a conference there outside of Austin, and I got to meet Dr. Robert Anderson, who headed that. And as I was circling the campus there, he started telling some metaphysical stories that just blew me away. And at those conferences, they taught energy medicine and quantum physics. So that opened my eyes, and that led down a whole new pathway. As when in about 2011, I had a patient share a spiritual near-death experience. I started quizzing patients, and that opened up an immense area that I'm now apply to my office practice. So it's, I could have retired 3 years ago, from a financial perspective, but I love what I do, and no one else is really, at least in my area, achieving the outcomes that we achieve with the approaches we use. So, yeah,
That's wonderful. Yeah.
that's
Well, how do you explain the connection between quantum physics and healing? Like, for instance, how do concepts like the double slit experiment or E equals MC squared
yeah.
relate to health?
Well, it's really foundational, which, obviously very few patients understand that. It was 1905 when Einstein said E equals mc squared, energy equals mass.
Uh-huh.
120 years we've had quantum physics, yet most doctors and scientists still don't grasp the significance of that. But it was 60 years ago when the double slit experiment came around. And with that experiment, you take a barrier and make two vertical slits, and you take a photon, and the photon will go through one of those two vertical slits and make a mark on the wall. That's if someone is observing. If no one is observing, what happens? The whole wall lights up. And why is that? It's not a photon going through, it's waves that are going through, and they go through both slits and mark up the whole walls. Now, if you take a video recorder and videotape it, what happens? You see a single mark on the wall. If you take the battery out of the video recorder, but put a tiny battery in to make a little red bleep to make it look like it's being recorded, what happens? The whole wall lights up. In other words, those waves know when they are being observed. They know when there's a battery in the video recorder and when there's not a battery in the video recorder. In other words, they have a consciousness and awareness. And if waves have an awareness, then everything, the chair I'm sitting in has an awareness. Now, hopefully not the level we have and not the level of what I consider the creator, which is far, far greater than that. But everything is alive. And that is foundational with that. Think of an atom with a nucleus 1 inch in diameter and the diameter of the atom 1 mile wide. So we were literally 99.9999999% hot air.
Okay.
And that's very important because every thought we're generating waves. If we're having positive thoughts, that penetrates readily our extremely porous body. If we're having negative thoughts, that likewise, and those negative thoughts are very detrimental to our health. The positive thoughts are very healing to our health. And in fact, it's my belief that if we can have positive thoughts 24/7, that we can heal essentially any disorder with that. But the trick is, how do you do that? The great athletes, if they want to win a race, what do? They visualize winning that race. So I teach my patients, when you wake up in the morning, say your prayers, set your intentions, let the universe know exactly what it is that you want. And the universe, the creator, wants to provide that for you. We're just surrounded by possibility, just by waves, and we generate that reality by observing those waves and by what we speak, what we hear. That's what helps generate the reality from the possibilities with that. So I tell my patients, set your intentions, say your prayers in the morning before you go to bed at night. What Nikola Tesla did was that he, with each one of his intentions, he wrote it down 3 times first thing in the morning, 6 times in the middle of the day, and 9 times at the end of the day. And that's how he manifested, was through that process. I tell patients to make an anger list of everyone they've been angry with their whole life and send love to those people every day. I tell them to forgive 3 people every day and maybe ask for forgiveness as well. 10 things you're grateful for each morning, 10 different things you're grateful for each evening. And if we have a negative thought, we may have 17 seconds to cancel that before it snowballs into second and third. So maybe out loud say cancel, cancel, or in your head, and then move out of your head and into your heart space. Your head's supposed to solve problems like changing a tire on a car, but it's not supposed to get tangled up in emotions. That's the heart's venue. The heart's about love and peace. So if you take some kind of chest belly breaths, move out of your head and into your heart space, those emotions fade away, and then move into a space of gratitude. We have indoor lighting, we have indoor plumbing, we have
Mhm.
climate control. We didn't have any of that 100 years ago. So we almost have to invent reasons to be unhappy these days.
Yeah, yeah. Can you share an example of how you've seen this play out in a patient's health journey?
Well, the very obvious, there are 2 ways to heal,
Uh-huh.
right? There's the physical ways to heal with medicine, with nutrients and so forth. But then there's the energetic way of healing, right? That's, you get a good prayer warrior, a group of people praying, you can have miraculous instantaneous healing because really the whole, universe is energy, and the basic unit of the universe is energy. So things can happen instantaneously because of that. And obviously, healing in that realm happens much better. I remember one of my small cell lung cancer, those are very aggressive cancers, and I actually had a student then who was with me, and I pray with most of my new cancer patients at the end of the visit if they are open to doing that. And she said the most beautiful prayer in association with that. Now, I didn't end up seeing that patient back, but her boyfriend, or excuse me, her ex-husband was a Vietnam vet, and he came by my house every week asking questions. And so I was giving advice. And we were using my botanicals along with conventional approaches. Things
Mhm.
initially weren't working out, but then combining immunotherapy with my approaches, and whenever the oncologist wanted to do steroids, I said no. And whenever the oncologist wanted to do Neupogen, the last I said no. And of course, no little Debbie's during chemotherapy treatments and so forth. And so, along with botanicals that I give, turmeric's basic, vitamin D in big doses with vitamin K2, and many others. And she lived 3 years when the oncologist had never seen a small cell lung cancer patient live beyond 1 year,
Wow.
and she never stopped smoking.
Oh.
So, did that prayer help in that healing process?
Yeah.
I'm sure it contributed to that. Do I see instantaneous healings in my office? I don't see that, but I understand quantum physics. I know that the power, every thought, every energy you send to the universe is going to generate a response. Every action generates a reaction, and if it's a positive energy you're sending out, you're always going to get a positive energy response. So that was the first thought
Yeah.
that came to my head when you mentioned that.
Yeah. You talk about the God gene and the dream gene. Can you explain what these are and how they influence our spiritual or intuitive capacity?
So I've been practicing now, if you can count my residency, for 47 years.
Hmm.
And so that's given me a chance to connect the dots with patients. And particularly over the last few years, I've made some interesting connections with that. I find that most of my patients, female patients, are the ones that I see primarily because they, we're living in an estrogen dominant world right now because we eat processed foods, which promote estrogen dominance. BPA in plastic water bottles promotes estrogen, and fat cells, we convert testosterone to estrogen. And all that higher estrogen increases sex hormone binding globulin, which binds up your testosterone, reducing free or available testosterone. So really, the whole country right now is at least 80% of the country, in my experience and opinion, is 80% estrogen dominant with low free testosterone associated with that. And it turns out, if you look at the genetics tied in with that, the COMT gene mutation is involved, the VAL158 MED is involved with metabolism of neurotransmitters, right? Dopamine, norepinephrine, epinephrine. So with that mutation, you have a good on switch and not a good off switch. So with that gene mutation, you don't metabolize, you don't detox as well, and you don't detox estrogen as well, and you don't detox other toxins. So those individuals are prone to burning the candle at both ends, and burnout, chronic fatigue, and fibromyalgia is an endpoint with that. Since you don't detox, if you get anesthesia, it's going to linger in your system longer. These individuals are very caring. They give and give and give and don't feel appreciated and have inner resentment tied with that. They have a divine understanding. These, if you're homozygous with that gene mutation, what I find, and these are, you tell them almost, you can tell almost instantly because they tend to be dressed perfectly. They have a serene smile. They have voluminous, perfect handwriting and notes and so forth. Very kind of OCD characteristics, which, you and I are in that category too, because, we cross the T's and dot the I's and workaholic and always have more projects. And at night we're trying to sleep and our brain is spinning with that. That's all a part of that gene mutation associated with that. But these individuals, if you're homozygous, these women have either known from the day they were born about the reality of divinity or by adolescence, almost 95% of the time, they have a knowing in higher power. That's a gift. Guys don't generally get that gift or that knowing or that awareness, but that's very powerful and they're very intuitive. So they read your energy instantly. They know whether you're positive energy or negative. They stand next to you and they'll know a lot more about you than you would ever want them to know. They have almost X-ray vision. Of course, their mother's intuition is extremely powerful. If their child's getting into trouble, it's instantaneous. Einstein felt there's nothing faster than the speed of light, right? The theory of relativity. But
Mhm.
yet there was something confusing he couldn't explain, which was what he called spooky behavior at a distance. If you take a particle and split it in half, and one half goes to one end of the universe, the other half the other end of the universe, any action on one half particle instantaneously acts on the other half particle the other in the universe. In other words, we all are instantly connected. Okay, that's very potent. And so mother's through intuition falls in that category. If your child's getting into trouble, it doesn't matter whether it's the next block or the other side of the world, you know that instantly.
Mhm.
And the fellow won the Nobel Prize in 2022, quantum entanglement. That's what that involves. So that explains how the universe is
Mhm.
all connected instantaneously. And that also kind of explains that there's no such true thing as space, because it's all just right here. It's not is another way to think about that. So and I speak particularly of women because they have more of the estrogen dominant aspects associated with this than the men do. I'll get to the men in a second. But they're also empaths. They get around negative energy. They don't do well around negative energy. They may walk into a shop and say, "Ooh, I've got to get out because of that negative energy with that." They're highly sensitive individuals. They're sensitive to foods, sensitive to odors, maybe sensitive to light, to noise, sensitive to electromagnetic fields, sensitive to mold. If they get a tick bite, they're going to have more of a reaction as far as Lyme disease tied in with that. And remember, they don't metabolize estrogen as readily, so they have female issues. They get fibrocystic breasts, ovarian cysts, they get premenstrual symptoms. And what are those? Anxiety, panic, obsessiveness, phobias, sleep disturbance, irritability, carbohydrate craving, swelling, breast soreness, tenderness, migraines, heavy periods, cramping, bloating, brain fog, aches and pains in joints and muscles. Okay, they get into gallbladder disease as well.
Mhm.
And estrogen promotes autoimmune activity, all autoimmunity. It's not just lupus.
Mhm.
Every autoimmune issue is driven by estrogen. And the antidote, ironically, is testosterone, which few rheumatologists understand, or immunologists understand. They think that anything that boosts the immune system is going to boost autoimmune activity. And that's not the case at all. So testosterone strengthens the immune system, but dampens autoimmune activity. So everything you do to block conversion of testosterone to estrogen is going to help every single autoimmune disorder. And the one at the top of the list for me is vitamin D. Vitamin D in males, for example, boosts testosterone 20%. And I tell my male patients, because that's all they hear is testosterone, I say, days you want to have more estrogen, skip your vitamin D on those days. And days you want testosterone, take your vitamin D on those days.
Mhm.
Fish oil, the days you want to shrink your testicles, skip your fish oil. Whenever you want to grow your testicles, take your fish oil. And men hear that. And so
Yeah.
balancing those hormones is really key. 80% at least need more of that free available testosterone and less estrogen tied in with that. So if I meet a patient and in her history, she has a history of allergies, guess what? I know another 30 things about her pretty much. That list that I just went through, 25, 30 things, nearly all of those are going to apply. If they've
Yeah.
had the gallbladder out, guess what? Nearly all of those 25 or 30 things, if ovarian cysts, if they are sensitive to electromagnetic fields. So it gives you an immense amount of information to be able to connect those dots, and as well as manage it with that, because there are a lot of nutrients. I mentioned vitamin D and fish oil, but turmeric, helps
Mhm.
block aromatase. Zinc blocks aromatase, and copper has the opposite effect, promotes aromatase, increasing estrogen levels. Resveratrol, quercetin, selenium, vitamin B2, green tea, all of those modulate hormones in a favorable way. And all of those not only block aromatase, but they block 5-alpha reductase, right? The conversion of
Yeah.
testosterone to dihydrotestosterone, which is exactly what you want. You don't want to block aromatase and switch that over to dihydrotestosterone 5 to 10 times stronger than testosterone, associated with acne, rosacea, male pattern hair loss, hair growth in unwanted places, in men, prostate problems with
Yeah.
that. Now,
Yeah.
going back to males just briefly with the guide gene, uh, they don't metabolize dopamine as readily, and therefore dopamine promotes growth of prefrontal cortex, the IQ part of the brain. So these men are actually a little bit smarter with that gene mutation, but they aren't necessarily happy. Again, the particularly the women, but even the men, they're in If they're homozygotes, they've been in fight or flight every single day their whole life. They don't know what peacefulness is.
Mhm.
They've never experienced that, okay? So they're gifted in terms of their intuition, in terms of their knowing of divinity, but they're burdened with this baggage of being in fight or flight continuously. And being estrogen dominant growing up for a female, that can attract negative energy. If you experience negative energy, your
Mhm.
adrenaline kicks in, bingo, that's PTSD because you can't metabolize it
Yeah.
because that's COMT, right? So PTSD is characteristic. So I tell all these women at their first visit, I say, listen, the religion that I belong to or been a part of, in order to be forgiven, you have to forgive, right? So it's not that someone else deserves it. First of all, you have to forgive yourself, and then you forgive others again, not because they deserve it, but you have to get rid of that yoke of unforgiveness to live in the present, not live in the past. And not the level I forgive you, but you're still a jerk, but a level of grace where if I grew up in your shoes, I might understand how that happened. And you'd be surprised how many women tear up and say, "Are you psychic? How do you know all of these things?" But these are all connected, and it gives you an immense tool in managing these estrogen dominance
Right.
situations.
Yeah. So that kind of leads me into the next question. What do you think is like the biggest mistake practitioners make when they're approaching hormone therapy?
Well, not considering all the involved hormones, I think is the biggest mistake with
Mhm.
that. And I think a lot of people think of estrogen dominance just in terms of estrogen and progesterone. And I
Yeah.
think that's a big, you've got to consider the testosterone
Yeah.
with that picture. And so, I've have great success in terms of managing premenstrual symptoms. 80% of the time, I can fix PMS with an herb called Vitex, chaste berry, which acts identically to progesterone.
Mhm.
And I prefer to use the botanical to the progesterone, though the progesterone is okay as well. And I have patients either just empirically, say day 14, start progesterone cream, say 20 milligrams twice a day at lunch and at bedtime, or the Vitex, one twice a day at those times. And then around day 21, bump up to double that amount. And day 25, go to triple that amount. And then 48 hours after menses starts, then stop that. And for 80%, that works beautifully for calming, relaxing, neutralize those symptoms. But 20% of the time, it goes the opposite direction and seems to promote estrogen. So instead of preventing breast soreness, it can cause breast soreness. Instead of being relaxing, it can cause stimulation. So in that situation, I actually throw the Vitex and or progesterone away and substitute a inositol, vitamin B8, which is an excellent hormone modulator. It dampens estrogen and dihydrotestosterone. In those situations, I give 1,000 milligrams every 8 hours, maybe the first week, 2,000 the second week, 3,000, then 4,000. Inositol at 4,000 every 8 hours has been shown to work as effectively as SSRI antidepressants for
Mm.
anxious depression. So between those two strategies, generally one of them will work. The other thing that I do is I give rhodiola rosea in that second part of the menstrual cycle. And actually, I will typically, and it depends on the size of the individual and how wired they are, because if you give rhodiola by itself, it can wire particularly thin, smaller women. But if you give it with Vitex or progesterone or inositol, then that balances that. So, for example, you could start rhodiola, say 250 milligrams on day 8, 30 minutes before breakfast, and around day 15, bump up to 500 milligrams, and then stay on that until 48 hours after the period starts. And that takes care of the brain fog.
Okay.
That manages that beautifully. And the way it works, it boosts all the neurotransmitters, but particularly dopamine. Again,
Mhm.
the IQ part, the focus part. So it's a terrific combination. I use rhodiola with ADHD. Works beautifully for those kids as well.
Yeah.
And one caution I would mention that I've learned, my wife actually taught me this, is that progesterone, relaxes muscle. And so if you snore at night and you take progesterone, guess what? That's going to relax those muscles and that can put you into sleep apnea.
Mm.
So that's a real caution with that. And also, I think of progesterone is a precursor to cortisol. So I think if you have yeast issues, that can maybe magnify yeast issues as well. So those are
Okay.
the two. With rhodiola, if you're bipolar, it can make you manic. It's a little bit drying. I think those are the two key things. And for me, I find that if you do it continuously, it stops working over time. So I like to use it either 3 weeks a month or 5 weeks. I mean, 5 days per week with
Okay.
using.
Oh, you have such an extensive knowledge of botanicals. I'm really
Mm.
impressed. So, what are your go-to botanicals for optimizing brain health and resilience?
Yeah, so obviously rhodiola, and
Yeah.
rhodiola is the one that convinced me that herbs are not placebos because
Okay.
it takes all of 30 minutes for rhodiola to kick in and have an effect with you. And the very first dose you take, you better take it the very first thing in the morning because if you take it mid-morning, it's going to keep you awake up half the night. It lasts
Mm.
all
Okay.
day long. There's not, the neat thing about it is there's not really a drop off. You know, if you drink coffee after 4 hours, you kind of crash. You take acetyl carnitine after 4 hours, you're going to crash. But with rhodiola, it lingers on and you drop down naturally, and it actually reduces your sleep requirements as well. So you jump out of bed better in the morning. So that's a priority. And I wrote a book, Brilliance, and I have a thick middle section about nutrients, botanicals, and other things that optimize brain health. And for example, I also have a handout called BDNF, Brain Derived Neurotrophic
Mhm.
Growth Factor, and I have a list of 40 different nutrients and herbs that promote BDNF, i.e., that promotes brain growth, right? So there are all kinds of ways to promote brain growth. It's really exciting. For example, lion's mane,
Mhm.
promotes BDNF and nerve growth factor. So turmeric promotes brain growth by two different mechanisms as well.
Mhm.
And so for me, yeah, I take maybe 100 supplement pills most days, or 100 different types of supplements most days, not because I like to take pills, but each herb has hundreds, if not thousands, of beneficial nutrients.
Yeah.
And if they promote brain growth, which one am I going to leave off, right?
Right. Right.
So that's a dilemma. I want to offer my body a cornucopia of nutrients. It can absorb what it needs, what it doesn't need can pass on through. And I realize, again, I'm a little OCD in taking a lot of those, but it's
Yeah.
served me well so far.
And how about peptide therapy? Have you used that for
That's
brain?
that's not an avenue that I've pursued.
Okay.
For different reasons. It's a little more expensive route. I don't know enough to really comment much, but I would say uh, I think of it a little bit like amino acids. If you give it one amino acid, that's going to suppress other amino acids, right? So they're going to be positive effects, but by suppressing other ones, would it create negative effects? And
Yeah.
so if you know what you're doing and can accommodate for that, then great.
Yeah.
So I know it's a lot of people are achieving good outcomes with that.
Yeah. Yeah. So, in your view, how do botanicals interact with the energy or consciousness of the body beyond just their biochemical effects?
Mm. Well, remember, everything is alive. Yeah, so plants have a native intelligence with them. So think of them in that regard. For example, with turmeric, there's curcumin. Everyone talks about curcumin. That's the one that's been researched, but
Hmm.
because people have learned how to make money off curcumin by affecting the absorption process with that, right? But if you have a chemical from a plant that has a beneficial effect to it, then it likely has a toxic effect with it as well. And then there's evolutionary pressure to evolve a second chemical in the plant to neutralize the toxicity of the first one. So plants tend to have built-in antidotes with them,
Yeah.
right? So I don't like so much to use just the single chemical derivative of a plant. I like to use, and it's fine to use curcumin, but I always want to use it with the turmeric as well.
Hmm.
And
Hmm.
I even have my own, organic Dr. Roach product that is 700 milligrams of turmeric with 100 of the C3 curcumin, for example. So you can call that intelligence. Of course,
Hmm.
the very more obvious things, I don't know how far we would want to delve into this, are with psychedelics, right?
Hmm.
Ayahuasca. Does ayahuasca have a spiritual quality to it? I don't think it would be very difficult to argue against that for people who've experienced that. So
Yeah.
ayahuasca, more obvious presentation, but think of all plants as having a consciousness and awareness and are service oriented, if you wish.
Yeah. You're not afraid to explore unconventional topics like near death experiences, transformative spiritual events, and even extraterrestrials. How do these fit into your understanding of health and healing?
Well, I guess it was about 2011 when my first patient mentioned about her spiritual near death experience. She was in a car accident and she was out of body up above the car looking down at herself, and she was in a blissful state. She felt wonderful. And then she came back in body and got mad about it, right? She didn't want to go back in body. And after that, she became mission oriented and focused. And she told me, I'm not afraid of death anymore. And I thought, what do you mean? Here I've studied my whole life, 23 years of education, 20 plus years of clinical experience to learn how to save your life. And you don't care whether you live or die. And I thought, well, that's kind of interesting. That'd be kind of nice to not fear death. And then I
Yeah.
thought, what if I could teach my patients they didn't need to fear death? And I thought, wow, what a preposterous thought. I could never do that. But I do exactly that now because, I've now had 105 patients with spiritual near-death experiences.
Oh,
And again, they report the other realm is more real than this realm. And there are different variations of it, but the themes are the same. They don't fear death afterwards. They feel in the presence of a divine source, and they come back more loving, caring individuals with that, and they become more intuitive after that. The more spiritual near-death experiences you have, the more intuitive you become. So, for example, with my new cancer patients, I point out to them that my spiritual near-death patients say the downside for you is ultimate bliss, right? So that's the worst that's going to happen is you're going to end up in a blissful state.
yeah.
So you're going to be fine. I'm working for your family. They want to keep you here, but you're going to be fine. And that's key because in cancer, the single most important thing is peacefulness.
Yeah.
They did research with mice. They implanted mice with breast tumors, and they stressed one group of mice, and the group that was stressed had a 30-fold increase in metastases. And when they
Wow.
gave the drug propranolol to block adrenaline, that prevented most of those metastases.
Mm,
So
that's
that's the
amazing.
single most important thing that we need to accomplish quickly with our new cancer patients. And of course, oftentimes when they go into the conventional medical system, see the oncologist, the fear of God is put into them immediately.
Yeah.
Those are not
Yeah.
generally spiritual, peaceful places, in one
No.
test into another test and so forth.
Right.
So hopefully those patients will come to me first so that I can um, get them spiritually in an understanding. I use a lot of inositol. The inositol IP6 is the one that's been researched both in prevention and management of tumors. That helps keep them in a peaceful state, as well as has those anti-tumor activities with it. And in a lot of patients, I actually do use propranolol in low doses. For example, today I called in a prescription of propranolol 10 milligrams, 1 to 4 times a day for a pancreatic cancer patient that came to see me last week from Ohio. And so for many of these tumors, propranolol makes a big difference.
Yeah.
And so you know the patients that I'm talking about, what I call COMT plus plus patients,
Yeah.
where they're really wired and so forth. If those individuals have cancer, then they're the ones that need the propranolol to really, it's used in Hollywood for stage fright, right? It's great for anxious depression. So HER2 neu is particularly associated with peacefulness. I remember my mentor, Donnie Yance, sharing a story that he had a patient, a woman who with breast cancer, got in an argument with her husband. Her HER2 neu blood level, now monitored those, went way up. And then she went on a 3-day silent retreat and it came right back down.
Yeah.
And I found that in my HER2 neu patients, when I use propranolol, when those HER2 markers go up, the propranolol will bring it down. It'll get them in a much more peaceful and happier place because they don't like to be
And
constantly.
can you just explain what the HER2 new markers are?
Sure. So a lot of individuals are familiar that when you get a breast cancer diagnosis, that it's put into the category of is it estrogen receptor positive or negative, progesterone receptor positive or negative. And then the third one is HER2 neu. It's now ERBBB2, I think, but HER2 neu is the easier way, I think, to remember that. And the standard one is the ER/PR positive, HER2 neu negative, and those have the best outcomes. And most postmenopausal women, 90% of them fall into that category. But if you have a HER2 neu, that's a more aggressive marker and more important to jump on quickly in terms of management. And
Mm.
there are some simple that, olives and olive oil, for example, are favorable in that situation. Chamomile tea, because the apigenin content is a particularly good one to use with that. Tocotrienols, Magnolia hanicale, or some others. That's one. Those HER2 neu cells are more friable. They're more prone to breaking loose from the primary tumor and causing metastasis and even going to the brain. So it's really key to keep those patients in a peaceful state to keep that from happening with them.
Yeah, absolutely. Okay. So you speak of miraculous cancer cures. Can you share a story that stood out to you, something that defied conventional expectations?
Well, I had a new patient come in last summer. In 2017, she was diagnosed with stage 4 cervical cancer.
Mm.
And her approach was the Gerson's therapy. She did juicing for 90 days and did coffee enemas 3 times a day for 90 days. And the end of 90 days, she was cured with that. And
Wow.
I'm sure a lot of guys would say, well, I'd rather be dead than do coffee enemas 3 times a day. But actually, I had a patient in yesterday, again, a pancreatic cancer patient, and he had been very reluctant about that. But he finally did. And he said, thank you. That's the best thing. I've been recommending it to all my friends. Do coffee enemas, but
Yeah.
particularly when you have abdominal pain or have abdominal related tumors,
Yeah.
coffee enemas are especially beneficial with that. I had someone who presented my conference about 15 years ago whose wife had stage 4 breast cancer, was sent home to die. They'd done all the conventional things, radiation, surgery, and chemo, and so forth. And what they decided to do was 11-day fast followed by a 10-day fast. And he read positive energy literature to her 24/7 while she was awake and while she was asleep over those 21 days. The end of 21 days, she was well. Okay. There's a spiritual healer outside of Cleveland, Ohio. He's been around for decades. I actually went to visit him last year. His name is Isam, Issam. Last name is Nemeh, Nemeh. You can get on, he does a Path to Faith broadcast, I think that maybe weekly, that you can get onto. And he's achieved some spiritual healings. He's had 2 near-death experiences himself.
Wow.
And again, the more of those you have, the more intuitive, more capable, the more you're tuned in to higher power. And so, he has had success. You don't have 100% success, certainly with that, but he's had many healings with that. With my patients, up till a few years ago, I said, well, I double or triple the outcomes. But I think at this point, it seems that outcomes are even better than that. Often, I had stage 4 Hodgkin's lymphoma. I still have her as a patient. She'd had chemotherapy for 3 years. And finally, the oncologist said, you're going to need to get stem cell therapy. You need to get bone marrow transplant. I said, nope, not going there. And came to see me. She got on a comprehensive protocol and she got on my herbal cytotoxic protocol along with that. That's my most aggressive protocol. But then she also, at this point, I was beginning to introduce some ivermectin in my treatment management. So we started her on some ivermectin. She had questions about fenbendazole. I can't recommend that officially, but I did educate her about that. She chose to start on fenbendazole. She went back in for a follow-up scan about 6 weeks ago, and her tumors had essentially evaporated. The oncologist was speechless with that.
That's
So that's
great.
a more recent example.
Yeah. So in cases like this, what role do you believe intention, belief, and spirituality play alongside with the physical treatments?
Well, really that's critical. You have to believe that you can get well. You have to want to get well. And, you don't have to get well. It's okay, to transition if that's what you want. Your soul is going to survive for an infinity. And I don't say that lightly. I say that based on, as I mentioned, 1,000 patients with transformative spiritual events and others. And when you hear those experiences 2, 3, 4 times, you think, oh, that's interesting. When you hear those 1,000 times, you
Yeah.
know, and they reinforce one after the other. We haven't gotten into transformative spiritual events, but what I'm referring to there are premonitions, intuitions, out of body experiences, voices, visions that don't talk about harming people, right? If it says go out and kill somebody, then you go see the psychiatrist and you need to be in a mental hospital, right? But if you get positive messages,
Yeah.
loving messages, then that's completely different with that. Your voices, visions, dreams with meaning, seeing, sensing spirits with that. And these stories are just incredible,
Yeah.
just incredible. And that led to my first book, God's House Calls, that has over 200 of those stories in it. And then my more recent book, Brilliance, has some more of those stories. But the stories will make your hair stand up on your arms with that. My wife, who's been my scribe and has heard so many of these as well. And that changes your practice, changes the lens you look through and looking at patients. So, yeah, if you want a positive outcome, you need to tell these cancer patients visualize your youngest grandchild graduating from college,
Yeah.
and smell that, taste that, elaborate on that as much as you can, because the more you create that image, the more you're creating that reality happening, right? Plan for vacations 5, 10 years down the road
Yeah.
because you're helping to create that reality because we're just surrounded with possibility.
Yeah.
What determines what becomes real is what we think, what we say, what we hear. So,
That's wonderful.
yeah.
If you could leave our listeners with one insight about healing that you feel the world isn't talking about enough, what would it be?
Well, I really think getting spiritually grounded is the single most important thing with that, because particularly in these days and times, the world is chaotic. There's a lot of fear out there, and that's the opposite of a healing scenario is chaos and fear, and it's the opposite of love.
Hmm.
And so I encourage my patients to, I think we're here to evolve into an understanding of unconditional love 24/7, evolve into a situation of gratitude continuously,
Hmm.
and being authentic, opening that third chakra and speaking our voice. And that's not speaking judgment, but we learn a lot here on earth, and we're supposed to share that wisdom. We're not supposed to keep it a secret. So share our knowledge, share our information, share our love, and practice saying a kind word, practice smiling to everyone you meet, because we all are connected. We
Yeah.
all are instantly connected. And so it's kind of like the golden rule is the simple way to think
Hmm.
about it. Do unto
Yeah.
others as you would have them do unto you, because guess what? We are all in this together, and maybe that is us that's
Yeah.
being impacted when we say something negative.
Yeah. Absolutely. And what advice do you have for practitioners who want to bridge science and spirit in their own clinical work?
Well, there are a lot of good conferences out there, and certainly, functional medicine conferences is a good first step for me. IFM conferences, I did attend all of those, a tremendous amount of knowledge and information there. There's some others out there as well. There's the Academy for Integrative Health and Medicine. That's a
Hmm.
good conference. If you're open-minded, there are even, Paul Anderson has some good naturopathic conferences that you may want to look at. And my mentor, Donnie Yance, has a botanical medicine program that you can sign up, the Madeira Center for Natural Healing. But if you want to learn about botanicals, and it gives you such more ammunition to deal with illnesses with. Uh,
Yeah.
Again, it's the other thing is do comprehensive testing. Stop just looking at CBCs, CMPs. I think as much as anything, D-dimer and fibrinogen are important levels. And I
Hmm.
think the single best way to protect against heart attack and maybe a stroke is systemic enzymes. And I use nattokinase. For example, research showed with the equivalent of 5,000 units of nattokinase, uh, you do it on an empty stomach, doing that daily resulted in a 66 to 95% reversal of carotid atherosclerosis. Dramatic, okay?
Huge. Yeah.
And
Yeah.
a simple thing you can do, put your arm under your spouse's neck tonight and see how long you can leave it there. I could only leave there 15 minutes before it started, 15 seconds before it
Uh-huh.
started falling asleep. And now that I do my nattokinase, I can leave it there 15, 20 minutes until she jerks it away. So that's a good, simple way to tell how your circulation's doing. And uh, with my cancer patients, uh, I've been treating for 17, 18 years. These are high risk people. So, number two is circulation, fourfold high risk for heart attack, stroke, tenfold high risk thrombophlebitis, pulmonary emboli. So, I'm monitoring their D-dimer fibrinogen levels. Comprehensive approach. I've not had a single patient that I can recall following our program that's had a heart attack over that 17, 18-year period of time. So, heart disease is preventable. It's so much fun to learn these strategies and apply them. It makes the practice of what we do so much more enjoyable.
It
So,
does.
yeah,
It does.
open your mind, open your eyes to possibility.
Absolutely. Well, this has been thoroughly enjoyable. Thank you so much for being a guest here on this podcast,
Oh, it's my
and
honor. Thank you.
appreciate it so much.
Yeah.
Thank you for joining me on The Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the functional edge.